Good morning. Welcome back. Virginia becomes the first state in the South to legalize recreational marijuana. Our next guest is a doctor who warned lawmakers against legalizing the drug, saying it will lead to an increase in mental health issues and car crashes. Dr. James Avery has been studying the effects of marijuana for years and joins us live now. Good morning, doctor. Thanks for being here.
Hey, good morning, Jillian.
So why do you think people aren't necessarily listening to what you have to say? Because if you look at the fact that the majority of Virginia voters support the legalization of marijuana, 68% of them do, it seems like people wanted this to pass.
Yeah, great question. So what's happened in the last 15 years? As medical science, the last decade been the decade of the brain in medicine. And in the last 15 years, we found that marijuana is more problematic than we initially thought. No question about it. Every expert will tell you that. But in the last 15 years, the average American views it as even safer than they thought 15 years ago. So we have this huge gap between the medical evidence, the science evidence, and what people believe. I mean, it's not that different than the early views of COVID or a pandemic. People need medical education. So, Jillian, I was in some of these hearings trying to get the medical evidence, the scientific evidence across, and instead they were debating how many plants can you grow in your home? How do we regulate this? Nobody seemed interested in really knowing what the medical science shows.
Why do you think that is, though?
I think it is there's four major groups that I found myself opposing. One is corporations who want positive. This is not hippie farmers growing pot in their backyard. These are major corporations that have well-paid lobbyists, number one. Number two, you have politicians who like a new tax revenue source. Number three, you have a group of, we'll call them extreme libertarians who really want unlimited and free, no access, no restrictions on any drugs. And then the fourth group is celebrities. Besides a few, most celebrities, if they go on a talk show, it's all laugh and giggles about marijuana. They're not talking about car crashes, increase in mental illness. They're not talking about pregnant moms and the unborns. One hospital in Pueblo, Colorado, 50% of the newborns had THC in their bloodstream.
Wow.
When they asked folks, why would you be using marijuana while you're pregnant? And they said, well, it's natural and it's green. That was by far the overwhelming comment. And it helped my morning nausea.
So in the 30 seconds we have remaining, what do you think is important for our viewers to know about this? Because I know that you're not against medical marijuana and different, reasons why people need to use it, but you're saying it shouldn't be legalized as a whole in the state.
Yeah. So if your state hasn't legalized it yet, don't. It's going to hurt, first of all, the poor and the disadvantaged. So, that's the same people who get hurt by cigarettes, alcohol, gambling, lottery tickets, etc. So first of all, do that. But if it's legalized in your state, let them limit the THC to 15%. Remember, the marijuana today is up to 30-40%. In the 60s and 70s, it was at 2%. So limit THC, strict restrictions on teen-friendly flavors. They are pushing this to teens. Prevent advertising, prevent commercialization. If you're going to legalize it, put tight restrictions so the people who are going to be hurt are protected somewhat. Regulations on driving while intoxicated. We can't even measure if somebody took marijuana a day before, a week before, or a month before.
Yeah, and this is all good information for parents to know, parents of teenagers as well. Dr. James Avery, thank you very much for joining us. Important conversation.
Great, thank you.
Have a good day.